Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Hello. Welcome to Advanced Nurses with ACD4N. And I actually have the coding nurse with me. One of the things I really wanted us to dive deep in is to transitions. This year for me, my services have really shifted towards helping nurses with transitions. And I found that no two nurses' experiences are the same. So therefore, find out what it is that aligns with what you are truly passionate about, and be realistic about your knowledge gap. Learning ICD-10 codes, it's something when you're doing a medical record a review and you're ignoring information in the chart because it's overwhelming or confusing, or you don't know the medical term. A provider could probably write something in the medical record, and it's terminology that is new or unfamiliar. Maybe it's a condition you've never seen, spelled out that way, or maybe you see an abbreviation for a condition or medication or something, and you're overwhelmed by it. You're like, oh, I don't know what this is, and it kind of leads you into doing some research. That's one thing. It's a whole different thing when you're looking at a medical record and you see, for instance, codes in there, and you look at the code and you don't know what that is, and you just blow it off and just like, oh, whatever. So one thing about learning about ICD-10 codes is that you really get the opportunity to see the record from a different perspective, and every single the various uses, not every single one, but the various uses of ICD-10 codes, like whether it's medical necessity or whether risk adjustment is used to predict the cost of care. You, especially around those ones that map to HCCs, and be specific about that. And so you get to look at the record from such a different perspective now that you get to this is where the provider education part comes in, because now you're looking at it like, okay, well, I see why the provider wrote X, Y, and Z in the medical record, but now understanding medical coding, you understand how it's going to impact how the coder is going to code that record. And so that's where CDI is born. So it's very important for nurses who are interested in even transition into roles where you're looking more closely at the medical record, for you to have an understanding of ICD-10 codes.
But I think that a lot of nurses, as they are trying to transition away from the bedside, and as we talk about medical coding, like the first thing that I think a lot of nurses have to do is a lot of nurses have to check their own biases about coding, because a lot of people, in fact, most people, have an entire misconception of medical coding, because a lot of people think that it's just merely just flipping through the book and finding a code and that's it. It is so much deeper than that. So much deeper. And a lot of people don't understand there are 22 chapters in that ICD-10 code book, and there are 22 different sets of guidelines and conventions you have to follow. And depending on what that person presents with at that episode of care determines how it gets coded. Why are they there? What were they admitted for? And what happened while they were there? All of that can change with one word. And they have to work around their biases, because I just have to interject for a couple seconds. I just completed a coding contract with a state organization. This was utilization review nurses for an entire state who reviewed Medicare, inpatient Medicare stays. When I tell you the level of resistance that I had just teaching the basics, because they didn't really think that they had to know it, or they thought they already knew things that they clearly had no clue about. And when the contracting officer would listen, because she had access to the meeting, she would listen in, and she was always clear to say, well, they're not coders. We have 3 coders and we have 40 something. They're not coders. So I had explained to her several times. I said, you say that all the time, but when it is your job as a nurse or anyone else to validate a code or validate a condition that involves a code, you are a coder. It is your job to know. You can't hide behind the fact, well, that's not my job title, because that's your job duty, is to know. Because if you're supposed to validate this code and you don't know the guidelines that surround how this code is applied and how it's sequenced, how are you doing your job? And I told her, I said, the reason why, I said, a lot of nurses are comfortable hiding behind, I'm not a nurse, I'm not a coder, because they think coding is beneath them. And it's not, because coding has provided a very, very nice living for me. Still does. Way more than the bedside, I promise you. And I just think there's a whole lot of education that has to happen. I think there's a whole lot of bias checking that has to happen. And you have to have a whole lot of humility to want to learn something different, or you should. I'm landing my plane with that one. Go ahead.
Well, no, listen, and I completely understand where you're coming from, because this is the reason why it's like, I know to one degree it almost seems strange, because it's like, how can on one degree you say that nurses can enter into CDI without a certification, and you're pushing nurses to get certified? It doesn't make any sense. But the truth is, it's because you don't want to be at work and you're starting a job where you have a learning curve and you're overwhelmed and you just back away from the job, because now they're introducing concepts that you thought was somebody else's job. So one of the things that have happened within the job market recently is that there has been a lot of merging of roles, and a lot of these merges, they've involved people picking up skill sets. So I'll give you a good example. So there was a time where you had seasoned nurses, and I'll just put it that way, who could go into roles and just say, oh, I've had experience in management, or I've had experience in leadership. And then they go into spaces, let's say a remote role, for example. And when they're working in this capacity, they are uncomfortable with technology. They're uncomfortable with reporting to folks who are not, physically in front of them. Maybe they're uncomfortable with statistics, they're uncomfortable with spreadsheets. And so then they start thinking that, again, like you said, it's not my responsibility. So they start finding all these other people to do the work for them, because they think that their job is just to show up and do the quote unquote high level conversations. That has changed. If you are going to take on a leadership role, you better feel comfortable doing presentations. It is not some specialized IT work to be able to do data analysis, to use a spreadsheet. There's nothing like woohoo about that. That's just basic stuff. But when you start telling yourself that it's the business analyst job, or it's that's too administrative for you, what you've done is you've taken away your ability to learn something, one, and now when it's time to actually own that information, you have to keep bringing everybody in to do your presentation for you, because you don't. And I've seen that happen before, where leaders don't even feel comfortable presenting on the team that they supposedly say they're managing, because they have removed themselves from having any relationship with the data analysis part of it. So if that's all administrative work, then now when it's time to report to the stakeholders, like, listen, this is what we're doing with your money, you can't speak to it because you thought that was administrative work.
We've been talking a lot about nursing and medical coding and CDI. Like there are a lot of opportunities aside from CDI that you can use, that you can get into as a nurse with medical coding knowledge. And the next huge opportunity is going to be data analytics. And this is where, if nurses know medical coding, they could be uniquely set up to dominate. Because back in January 2023, I started a data analytics course, and it was SQL, a little bit of SSRS, and Tableau and Power BI. But for me, what was kind of missing for me was, I'm like, I want to learn this, but I'm not interested in how many boxes of chicken somebody sold in a month. I'm like, that the examples weren't interesting to me. So I'm like, but I learned enough from the process to know how that could be adapted to medical codes and data analysis. And case in point, so now fast forward, I started in 2023. Earlier this month, I was contacted by somebody who was trying to, somebody had contacted them about this opportunity by a large dialysis provider. They wanted to do, they needed somebody to do data analysis and also risk adjustment auditing. And it's a pretty hefty contract, like almost $700,000. So these people have a data analyst in mind. He's actually a data engineer, and what he put together personally was some foolishness, because what was lacking was the specificity that they needed, and you only get the specificity from ICD-10 CM codes. You have to write, me with the knowledge I have of SQL and Python, especially for SQL, you have to write a whole lot of queries and you have to have a whole lot of text to get all the different types of diabetes. But if you have a row of codes and you know which codes you need specifically for diabetes, your search can be seamless and you can have it done in minutes and have the exact information you need to make the analysis that the stakeholders need to make effective decisions. That's the power of coding.
Oh, yes. Because I know for me, it was first learning CDI that attracted me to data analytics, and then even attracted me to even project management. And I say that to say, it was when I realized, like, well, here's the question I would want to pose to any viewer. So the World Health Organization, essentially, they oversee, they are the powers that be that oversee these ICD-10 codes. These are international classification of diseases. Okay, so when the National Center of Healthcare Statistics is one of the cooperating parties, along with AHA, American Hospital Association, and CMS, and AHIMA, the American Health Information Management Association, one should think to themselves, I wonder how all of those different organizations, those 4 cooperating parties, I wonder how they work with the World Health Organization to use these ICD-10 codes. And then once your mind starts going in that way, you should be thinking to yourself, wow, you can use these ICD-10 codes to do tons of things. And so when you start thinking about that, I would be thinking, when I'm thinking data analytics, I'm thinking to myself, wow, how about looking at every single type of COPD? How about looking at every single type of diabetes, like in this case what you were saying, and you're looking at them through looking at the categories, and then looking at the specific conditions associated with these, and the underlying conditions. And when you start really learning more about ICD-10 codes, you start understanding how difficult some providers' jobs are around diagnosing. You know what I mean? And also why some things don't get paid for, and you get sent a bill to your home and you're like, how come that wasn't covered by the insurance company? Well, it all came down to the documentation, what was in there. What diagnosis did they select that would cover this or not cover it? And so when you start thinking more globally, and this is the thing I really want to encourage nurses to do. Don't just think that I want to be a CDI. I want to go on to CDI. Think about all the things you can do when you start learning about other areas of healthcare. You start learning about revenue, you start learning about risk adjustment. Think about care coordination from a population level, for example. It's one thing if you're taking care of a panel of patients. What about if you were taking care of a group of patients and all of them have one condition? What are some commonalities that you see among your patients? Even in a job, the job you have now, the work that you do now, this is for all the viewers, listeners. Think about ways that you can have a greater impact across a larger group of patients. So not just the 1 or 2 patients that you take care of every day, or the 4 or 5 patients that's assigned on your shift. Think about patterns that you've seen across all patients, let's say with CHF, and how now can care coordination be modified in ways that you can have a greater impact, or that those patterns are now meaningful insights. You can have actionable insights coming from looking at patterns across patients with a particular condition. And again, like Jesse's saying, looking at that ICD-10 code, okay, well, let's look at all the patients with that ICD-10 code, and let's look at some commonalities amongst those patients. What are some other conditions that we see coexisting with those conditions? And what are the patterns around mortality and morbidity that we see around those patients that also have those other coexisting conditions? Find a topic that you find particularly interesting, especially if it relates to the specific area that you're working in. So if you're working in long-term care, listen to a 45-minute, maybe even 20 minutes, as short as 20 minutes, webinars that CMS is covering on maybe some new initiatives around looking at quality in like nursing home or long-term care facilities. Listen to what they're talking about, and start to make those connections for yourself. It's not always about getting another certification and getting another degree. And so, unfortunately, especially if you are coming from lower resourced communities where you have the issue or barrier of kind of not having that head start. So you're coming into college, or you're coming into your post-high school education and into nursing training, but you're kind of behind the 8 ball. So maybe your grammar isn't really that good. Maybe you're not really comfortable writing, and maybe you don't really have a lot of experience doing extensive research, or you haven't been, required to do projects when you were in your high school years or middle school years. And so therefore, diving into this kind of self-work, as far as self-teaching and things like that, is just not something that comes to you naturally. I completely get it. So it's better for you to start doing your research based on the place that you currently work at. ICD-10 codes and understanding CDI, of course, I had the help of the coding nurse, but I was able to make the connection because I thought about it from the lens of a case manager.
Right. Mm-hmm. And I also wanted to, like, when you were talking about medication, and it all, comes down to, like, documentation becomes data, and data affects decisions. Because, like, even with medication, like, how do we think that the information came out about Black people being adversely affected by lisinopril? That's data.
Yep.
Somebody had to, right. Mm-hmm. Somebody had to put that together and come up, and the data showed a cause and effect. There is all kinds of ways that the knowledge that we have and the skills that we learn can be utilized in a whole bunch of ways. And the thing about HIM is just as broad. Actually, I think it's broader than nursing, and nursing is broad. But there's, I didn't realize it until I got involved in it. There are way more people behind the scenes than there are in front of the scenes in healthcare.
Oh, yes. Oh, yes. See, the limitations of nursing is that nursing means that you had to acquire the specific set of skills, right? Nursing still very much is a kind of patient-facing thing. You can transition away from it, as what we're talking about in this conversation, but it's very much still patient-facing, especially in the early parts of your training. HIM is a whole different other ballgame, because you're talking about everything from patient care to regulatory stuff. Yeah. You're talking about everything from finance to operation, compliance. I mean, when you start thinking even about the different, let's just think about it from this perspective. Just consider for a moment the different departments that CDI may collaborate with. Just if you were building a CDI program, which FYI, most CDI training is focused on training on how to actually establish CDI programs. So you gotta have to have a very entrepreneurial spirit, even if you are just learning CDI, just learning about it from its, I guess the basics. That's a part of the basics, is really understanding benchmarking and how to demonstrate that the program is effective and actually having an impact. But back to what I was saying, you could have a CDI program that literally is housed in the finance department, or is under HIM, or it's under compliance, or it's under operations, because it just depends on that institution, that organization, and their need. So that's, for me, I have looked at CDI as a gateway into HIM. And I don't look at it particularly as being like it like is exclusively HIM, but I look at it as a gateway. Like, once you actually start to understand CDI programming, you understand the nuances, you understand the different parties, and even the different job titles that work within that CDI, that within that paradigm. It is, man, the opportunities are literally endless.
Yep. Because the thing about nursing, when you look at in terms of the revenue cycle, when you look at nursing is considered mid-cycle. And CDI is considered mid-cycle. But HIM encompasses all three cycles. For instance, what I've realized about my transition into HIM is that I've had way more influence being in HIM than I ever did as a floor nurse. Because as a floor nurse, yes, you impact your patient directly and it's good for them. But in terms of like reach of impact, as a floor nurse, you're never ever going to have to meet with the chief medical officer or the chief financial officer and the people who really, really make some decisions. And I have had chief medical officers calling me after hours, wanting to have conversations. Well, what do you think about this or that information? Or and matter of fact, like even just getting back to data. Like, I worked somewhere where I was just tracking, because I was the coding and compliance auditor for this particular area. And I was just tracking how many clinics, how many site visits each clinic had. And so when I sent my report, I just was tracking it. So I added it, and the chief medical officer reached out to me. She was like, "Oh my God, that is good information," because we projected, as it turns out, they were seeing more patients than they were projected to see when they created the concept. Once again, the power of data and knowing the impact that you can have.
This also helps me to understand, as we wrap up, why it's important for nurses to develop specific skills, even where you're at, and then go ahead and challenge yourself to really do an examination, your own assessment of what skills you need to acquire and where you want to go and how it complements what you're doing now. And so you can use the 6 weeks journal actually to really, there's objectives in the journal, there's reflective writing in there. It is not a long journal, it's not 50 pages. It is very short because it is about you doing the work and documenting your progress. I want to hear from you about what services you are offering right now, and also as far as your classes, because I know you mentioned that you are now back to teaching CDI. So what services are you offering now, and how can people get in contact with you?
Okay, I currently offer ICD-10 CM training. It is an 8-week course. We meet twice weekly in the evening for 8 weeks, and then I also offer ICD-10 PCS training. And in order to take the ICD-10 PCS training, you either have to take my ICD-10 CM course or you have to pass an ICD-10 CM assessment that I give you before you can go into PCS. And PCS is 6 weeks, and it is also twice weekly for 2 hours in the evening. And I haven't revamped the CDI course yet because I'm really, really, really thinking about pivoting into instead of CDI, just teaching data analytics.
I completely understand that. You know, the nursing risk adjustment and data analytics course that I offer is a course that looks at case studies and is specific around really program design and helping nurses to kind of think about how data can be used for different decision making within like healthcare and like healthcare related topics. But I think when the more you learn about data analytics, you realize like how much it helps make sense of the information. So I completely understand why you are shifting, because once you do that shift, you also help nurses to kind of change the way they're thinking about things. Because think about it, if you change the way that nurse is thinking about data as it relates to CDI and managing data that is related to CDI or the medical record and parts of the medical record, and really doing analysis of that information, you're helping that nurse to gain a skill that they can use the very next day. I mean,
Right.
that's something you can use immediately. Going even back to what I was saying about people going into leadership roles, all of the opportunity may be there for you to take a leadership role. If you don't have skills like, for instance, data analytics skills, you're not comfortable doing analysis, you're not really comfortable using spreadsheets. These are basic skills that you really, really should master. So what the coding nurse is essentially offering you is an opportunity to really change your mind and shift the way you're thinking about the way information is collected. Because the 101 of data is clean, reliable data. That's the basics. So now when you are even collecting patient information, it should empower you to have a standardized way of communicating, not just using terminology that could be vague or misunderstood. And so that was one of the things that really was transformative for me when I started learning with the coding nurse about CDI. It transformed the way I documented because I stopped using vague terminology when communicating with providers, or even just documenting on patients within the medical record, because now I knew that my documentation had to be more deliberate, using terminology and phrases that would lead to more specific outcomes or paint a more specific picture of the patient's needs. If the opportunity is there to use numbers, to use those numbers. And it actually helped me in a leadership role that I was in, creating audit tools, because with that I moved away from having one-on-ones where I was just kind of talking about like just checking boxes. Oh, what are your goals and how can I help you reach your goals? I was actually using an audit tool Excel spreadsheet. I just plugged some formulas in there. I was able to actually see how the team of nurse analysts that I was working with, how they performed over time. I was able to give them, pivot tables and bar charts just to really show them how they have been progressing in their documentation. And even though that may seem like, well, why would you go all the way there doing that? Well, one of the things you want to do as a leader is you never want to come across seeming that you are like having favorites or personalizing one-on-ones. So when you're using numbers, it allows you to be more objective. Right. So now I'm
Right.
using this very specified audit tool. here are this is the number that's coming from the audit tool, gives you opportunity to kind of walk through areas where there's opportunities for improvement without people feeling personal, like it's a personal, critique. But again, so please don't miss the opportunity to reach out to the coding nurse. Could you share, if you don't mind, I'm going to put it in the description of the video as well, your website and email address.
Yes. My website is thecodingnurse.com, and you can go to thecodingnurse.com and you can click on contact us, and you can send me a direct message. And my email address, the easiest email address is info@thecodingnurse.com.
Perfect. And thank you so much for your time. I'm hoping that nurses will take the opportunity to reach out, the resources. I actually may even insert your website, just an image of the website, so they can see exactly where they can contact you, just with that image there.
Okay.
All right. Thank you.
Thank you.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.